If I told you that the pill you've trusted for years could quietly be stealing your memories, would you believe me? Picture this. An 82-year-old father sits across from his daughter at the dinner table. She smiles and says, "Dad, do you remember my birthday is tomorrow?" He looks at her with confusion, forces a smile, and whispers, "I'm sorry. Remind me again." In that heartbreaking moment, it's not just a forgotten date. It's a piece of a lifetime disappearing. Families often blame aging or bad luck, but what if one hidden factor has been sitting inside the medicine cabinet all along? That's why you must watch until the very end, because one of the medications we're about to discuss is taken by millions of Americans every single day, and most people have no idea. Researchers have questioned its possible connection to memory decline. Hello, I'm Dr. William Lee. As a physician, one of the hardest conversations I have is with families who ask the same painful question: "Doctor, could this have been prevented?" While no one can promise to prevent dementia, we do know that protecting the brain starts long before the first memory slips away. Over the past decade, scientists have been investigating whether certain commonly used medications may contribute to cognitive decline in some older adults, particularly when they're used for long periods or in high cumulative doses. These medicines often provide real medical benefits, and they should never be stopped without talking to your healthcare provider. But understanding the evidence could help you ask the right questions and potentially protect your brain for years to come. Most people think dementia appears overnight, but it doesn't. Changes inside the brain can begin many years before symptoms become obvious. That's why researchers are paying close attention to anything that may increase risk over time, including medications that affect the brain's delicate chemical balance. Some studies published in respected medical journals have found associations between certain drug classes and an increased likelihood of dementia, although these studies do not prove that the medications directly cause the disease. Factors like age, genetics, heart health, sleep, diabetes, and lifestyle remain incredibly important. Even so, medications are one risk factor that you and your doctor can actually review together. The first group of medications on our list is especially important because many people take them without realizing they can affect the brain. They're called anticholinergic medications. That name may sound complicated, but the idea is simple. Your brain depends on a chemical messenger called acetylcholine to create memories, support learning, and keep nerve cells communicating effectively. In fact, one reason memory declines in Alzheimer's disease is the loss of acetylcholine activity. Now imagine taking medications that repeatedly block this important brain chemical. That's exactly why researchers became concerned. Anticholinergic drugs include certain allergy medications, some nighttime sleep aids, treatments for overactive bladder, medicines for motion sickness, and even a few older antidepressants. Many are available over the counter, leading people to assume they're completely harmless. But for older adults, especially those taking several medications at once, the effects may add up over time. Large observational studies, including research published in JAMA Internal Medicine, have found that people with higher long-term exposure to strong anticholinergic medications appeared to have a greater risk of developing dementia later in life. These findings don't prove cause and effect, but they are significant enough that many physicians now carefully review anticholinergic burden when caring for older patients. The most frightening part is that the warning signs can be so easy to miss. It may start with forgotten appointments, difficulty following conversations, losing track of familiar words, or feeling unusually confused after taking what seems like an ordinary medication. Families often dismiss these moments as just getting older, when they may actually be signals that deserve a closer look. But if you think this first medication is surprising, wait until you hear about the next one. It's prescribed to millions of Americans every year, and the research surrounding its possible impact on brain health has sparked intense debate in the medical community. Now let's talk about a medication that millions of Americans rely on every single day, often without giving it a second thought. Proton pump inhibitors, commonly called PPIs, are prescribed for chronic acid reflux, stomach ulcers, and heartburn. If you've ever taken one for months or even years, don't panic. These medications can be extremely effective and are often the right treatment, but researchers began asking an important question when some long-term observational studies suggested that prolonged use might be linked with a higher risk of cognitive decline. The evidence has been mixed, with some studies finding an association, while others have not confirmed a clear connection. That uncertainty is exactly why you should never ignore this conversation. Instead, it's a reminder to ask your doctor whether you still need the medication, whether the dose is appropriate, and whether regular reviews could reduce unnecessary exposure. Scientists have explored several possible explanations. One theory is that long-term use may reduce the body's ability to absorb vitamin B12, magnesium, and other nutrients that play important roles in healthy nerve function. Low vitamin B12 levels in particular have long been associated with memory problems and confusion in older adults. Another possibility is that changes in the gut microbiome may indirectly influence inflammation and brain health, though researchers are still working to understand these complex connections. The key message isn't that these medications cause dementia, it's that long-term treatment should always be reevaluated to ensure the benefits continue to outweigh any potential risks. The next group of medications may surprise you even more because they're commonly prescribed to help people sleep or manage anxiety. Benzodiazepines have helped countless patients through difficult periods of insomnia, panic attacks, and severe anxiety. Used for short periods under close medical supervision, they can be valuable tools. The concern begins when these medications are used continuously for months or years, particularly in older adults whose brains become more sensitive with age. Benzodiazepines work by slowing activity in the brain, creating a calming effect that helps people relax and sleep. But that same calming effect can also reduce alertness, slow reaction time, interfere with attention, and make it harder for the brain to form new memories. Many older adults describe feeling mentally foggy without realizing the medication itself may be contributing. Falls, fractures, daytime drowsiness, and episodes of confusion become more common, creating additional health problems that can further affect long-term brain function. Several observational studies have examined whether prolonged benzodiazepine use is associated with dementia risk. While researchers continue to debate whether the medication itself is responsible or whether the underlying anxiety and sleep disorders explain some of the increased risk, many medical organizations now recommend using the lowest effective dose for the shortest reasonable duration whenever possible. That's especially true for adults over 65 whose bodies process these medications more slowly than younger individuals. But we're only getting started. The next medication category is hiding in plain sight because many people purchase it without a prescription. They take it for seasonal allergies or to help them sleep, believing it's completely harmless simply because it's sold over the counter. Yet for older brains, the story may be very different. Before you reach for that familiar bottle tonight, you'll want to hear what the latest research has uncovered, because the next revelation could change the way you look at one of the most common medicines in America. Now let's look at another medication that often catches families by surprise. Certain first-generation antihistamines, commonly used for allergies and sold over the counter, also have strong anticholinergic properties. Many people take them night after night because they make them sleepy, never realizing they may also interfere with the brain chemical acetylcholine. For an occasional allergy flare, these medicines may be appropriate. But when they're used regularly for months or years, especially by older adults, physicians become much more cautious. If you find yourself depending on an over-the-counter sleep aid every evening, it's worth asking your healthcare provider whether a safer alternative exists. Another category doctors review carefully includes some medications used to treat overactive bladder. While these drugs can greatly improve quality of life, many older versions also block acetylcholine, increasing the overall anticholinergic burden. When several medications with similar effects are taken together, the impact on memory and concentration may become even more significant. This is why medication reviews are so important. Sometimes the goal isn't stopping a medicine, it's replacing it with a newer option that has less effect on the brain. Opioid pain medications also deserve attention. These drugs can be essential after surgery, during cancer treatment, or for certain severe pain conditions. but prolonged use may contribute to persistent drowsiness, slower thinking, reduced attention, and episodes of confusion, particularly in older adults. Chronic pain itself can also affect memory, making the picture even more complicated. That's why pain management should always balance effective relief with protecting long-term brain health. Even some older antidepressants and certain medications used for nausea or motion sickness may have anticholinergic effects that become more concerning with age. This doesn't mean every person taking these medicines will develop dementia. Far from it. The message is that every medication should have a clear purpose, the lowest effective dose, and regular follow-up with your healthcare provider. Modern medicine continues to evolve, and in many cases there may be newer treatments that offer similar benefits with fewer effects on cognition. So what can you do starting today? First, never stop a prescribed medication on your own. Suddenly, discontinuing certain medicines can be dangerous. Instead, schedule a medication review with your doctor or pharmacist, especially if you're taking several prescriptions or over-the-counter products. Bring every bottle, every vitamin, and every supplement. Ask one simple question: do I still need each of these? And are there safer alternatives for someone my age? That conversation alone could make a meaningful difference. Protecting your brain also means protecting your heart. Regular physical activity, quality sleep, controlling blood pressure and diabetes, staying socially connected, eating a nutrient-rich diet, and keeping your mind active all have stronger evidence for supporting long-term cognitive health than any single supplement or miracle cure. Brain health is built through small, consistent choices made over many years. If today's video opened your eyes, don't keep this information to yourself. Someone you love may be taking one of these medications without knowing the questions they should ask. Share this video with your family and friends and start a conversation that could help protect the memories that matter most. Have you or someone close to you ever noticed changes in memory after starting a medication? Tell me your experience in the comments below. I read them carefully, and your story could help someone else ask an important question. If you found this video valuable, subscribe and turn on notifications, because in our next episode, I'll reveal everyday habits that leading brain health researchers believe may help reduce the risk of cognitive decline and support a healthier, sharper mind as you age.